A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a stark warning, Alan Milburn, former Secretary of State for Health, has declared that the National Health Service, NHS, is in its worst condition in his 30-year career in health policy. Milburn's comments come on the heels of Chancellor Rache announcing a substantial £22.6 billion increase in day-to-day NHS spending, the largest real terms increase since 2010, excluding the COVID-19 pandemic. This funding, alongside an additional £3.1 billion in capital investment, aims to address the pressing issues facing the health service. However, Milburn cautions that simply throwing more money at the problem will not suffice. He emphasizes the need for a cultural shift within the NHS, stating, "People have got to stop thinking that the answer to the NHS problem is simply more and more money." As he steps into a pivotal role as a key advisor to Labour's health spokesperson Wes Streeting, Milburn is expected to advocate for significant reforms to ensure that every pound allocated to the NHS is utilized effectively to improve patient outcomes. His call for a culture of change resonates with concerns raised in a recent BBC investigation, which revealed that senior consultants earning the highest salaries are often part-time, allowing them to charge exorbitant rates for overtime work. Milburn's perspective aligns with the Labour Party's commitment to reforming public services, as leader Keir Starmer has emphasized that no additional funding will be granted without substantial reforms in place. Milburn's prior experience during the New Labour era, where he implemented measures that successfully reduced waiting times, has led to mixed reactions regarding his connections to the private healthcare sector. Critics fear that his appointment may signal an increase in private sector involvement in the NHS, which could undermine the principles of the public health service. Nevertheless, Labour sources have countered these concerns, asserting that their priority is to enhance services for patients rather than adhere to ideological stances. The government is poised to unveil a comprehensive 10-year plan for the NHS, focusing on key areas such as digitization, community care, and preventive health measures. As the nation awaits the announcement from Health Secretary Wes Streeting, the urgency for reform has never been more pronounced. With Milburn at the helm of advising on these changes, the expectation is that the NHS will shift away from its dependency on increased funding and embrace a more efficient, reform-driven approach to healthcare delivery. The upcoming policies are anticipated to address the inefficiencies that have plagued the NHS despite the recent influx of resources. Milburn's assertion that the NHS is drinking in the last chance saloon serves as a clarion call for immediate action, urging the entire nation to unite in support of the health service during this critical juncture. As the government prepares to roll out its new strategies, the focus will be on ensuring that the NHS is not only well-funded but also well-managed, with a clear pathway to sustainability for the future. The challenges ahead are daunting, but with a collective effort and a commitment to reform, there is hope for revitalizing one of the UK's most cherished institutions. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.